COVID-19. Comprehensive Overview 1. Epidemiology. Welcome back to the Everything Surgery podcast, where today we are taking a deep dive into the story of COVID-19, also known as coronavirus disease 2019. This illness results from infection by the severe acute respiratory syndrome coronavirus 2, a new type of beta coronavirus that was first detected in Wuhan, China, in December of 2019. In just a few months, the outbreak escalated and was officially labeled a global pandemic by the World Health Organization on March 11, 2020. Transmission. The coronavirus spreads mainly through respiratory droplets and aerosols, but can also be transmitted via contaminated surfaces and possibly through the fecal-oral route. One of the reasons for its rapid spread is its high transmissibility. Early variants had a basic reproduction number estimated between 2.5 to 3. But this increased with the emergence of new variants such as Delta and Omicron. Global impact. By early 2024, there had been over 700 million confirmed cases and 7 million reported deaths across the globe. It is important to note that the actual numbers are likely higher due to underreporting. Risk factors. The risk of severe illness and death is much greater in older adults, people with underlying health conditions such as high blood pressure, diabetes, obesity, cardiovascular disease, and immune system suppression, as well as those who have not been vaccinated. Variants of concern. Over time, several variants have emerged: Alpha, Beta, Gamma, Delta, and Omicron, each influencing how easily the virus spreads, the severity of disease, and the virus's ability to evade the immune system. Currently, Omicron subvariants are the most common globally because of their increased transmissibility and partial ability to escape immune responses to pathophysiology. Viral entry. Let's talk about how the coronavirus invades the body. The virus attaches to the angiotensin-converting enzyme 2 receptor, which is highly present in the lining of the respiratory tract, particularly in type 2 alveolar cells. It is also found in the cardiovascular, digestive, kidney, and nervous system tissues. The viral spike protein, with the help of host enzymes like transmembrane protease serine 2, enables the virus to enter these cells. Key mechanisms. Direct viral damage. Infection leads to damage of the alveoli in the lungs, often resulting in pneumonia and, in severe cases, acute respiratory distress syndrome. Dysregulated immune response. Hyperinflammation. A phenomenon known as the cytokine storm, with elevated levels of interleukin-6, tumor necrosis factor alpha, and interleukin-1 beta, can lead to failure of multiple organs. Lymphopenia. This refers to a decrease in CD4 and CD8 T cells, which disrupts normal immune regulation. Thromboinflammation. Damage to the inner lining of blood vessels triggers clot formation, resulting in small blood clots and complications such as pulmonary embolism, strokes, or injury to the heart muscle. Post-acute sequelae. Long COVID. Some individuals experience lingering symptoms like fatigue, shortness of breath, and cognitive issues, possibly due to persistent viral presence. Autoimmune reactions, small vessel problems, or ongoing inflammation. 3. Diagnostics. A molecular testing. Reverse transcriptase polymerase chain reaction. This is considered the gold standard for detecting current infection. It identifies viral genetic material from samples taken from the nose, mouth, saliva, or lower respiratory tract. This test is highly sensitive and can remain positive even after a person is no longer infectious. Rapid nucleic acid amplification tests. These are quicker, point-of-care versions of molecular tests. B. Antigen testing. Rapid antigen tests. These detect viral proteins and offer faster results. Although they are less sensitive than molecular tests, they are most reliable within the first 5 to 7 days of symptoms. Advantages. These tests are inexpensive, provide results in about 15 minutes, and are suitable for use at home. C. Serology. This testing looks for antibodies, specifically immunoglobulin M and immunoglobulin G, against the coronavirus. This can tell us if someone had a past infection or has been vaccinated. Not for acute diagnosis. Antibodies do not appear until 1 to 2 weeks after infection. This method is most useful for studying the spread of the virus and for evaluating immune responses. De-imaging. Chest computed tomography. This imaging may show patterns such as ground glass opacities, consolidation, or what is called a crazy paving pattern, especially in moderate to severe pneumonia. While not routinely used for diagnosis, it is helpful in identifying complications for Treatments. The approach to managing COVID-19 depends on how severe the disease is, the patient's individual risk factors, and how susceptible the particular variant is to medications. Antiviral therapies. Nirmatrelvir with ritonavir. Paxlovid. This oral medication is a protease inhibitor used in patients with mild to moderate COVID-19 who are at high risk. It should be started within 5 days of symptoms, and has been shown to reduce the risk of hospitalization or death by nearly 89%. Remdesivir. This is an intravenous antiviral that inhibits the viral RNA polymerase. It is used for patients who are in hospital or at high risk of severe disease, and offers modest benefit for those with severe symptoms. Molnupiravir. This oral antiviral is an option for high-risk adults when other medications are not available, although it is less effective than Paxlovid. Immunomodulators. Corticosteroids. Medications such as dexamethasone are the first choice for hospitalized patients who require oxygen, as they suppress inflammation and reduce the risk of death in severe cases. Interleukin-6 inhibitors. Drugs like tocilizumab and sarilumab, as well as Janus kinase inhibitors such as baricitinib and tofacitinib, are used in cases of severe inflammation, often together with corticosteroids. Anti-SARS-CoV-2 monoclonal antibodies. These therapies have limited effectiveness against newer variants, so their use depends on which strains are circulating. See supportive care. Oxygen therapy. This includes methods such as high-flow nasal cannula and non-invasive ventilation for those with respiratory distress. Anticoagulation. Blood thinners are used to prevent or treat blood clots, depending on the patient's risk. Management of complications. This involves addressing acute respiratory distress syndrome, sepsis, and bacterial co-infections as they arise. Prevention. Vaccination. Vaccines based on messenger RNA, viral vectors, and protein subunits, such as Pfizer-BioNTech, Moderna, AstraZeneca, Johnson & Johnson, and Novavax, greatly reduce the risk of severe disease, hospitalization, and death. Updated booster shots are designed to target the most common variants. Public health measures. Preventive strategies include wearing masks, improving ventilation, practicing hand hygiene, and following quarantine or isolation protocols when necessary. 5. Emerging challenges and future directions. Long COVID. Managing persistent symptoms requires a multidisciplinary approach, and research into the causes and treatments is ongoing. Variant evolution. Continuous monitoring is needed, along with adaptation of vaccines and antiviral therapies in response to new variants. Health inequities. There are still major disparities in access to vaccines, health outcomes, and the burden of long-term symptoms around the world. Antiviral resistance. Careful surveillance is essential for detecting mutations that may lead to resistance, particularly in people with weakened immune systems. Conclusion. COVID-19 continues to be a major public health challenge. Vaccines and available treatments have helped reduce deaths, but the virus keeps evolving, which means we must continue to adapt our diagnostic tools, therapies, and preventive measures. The long-term management of this pandemic requires a comprehensive approach that brings together medical science, public health, and international cooperation. Thank you for joining us on the Everything Surgery podcast. If you found this episode helpful, please like, share, and subscribe. Until next time, stay safe and stay informed.